The other big dysfunction is a femoral torsion. Your femurs naturally sit, or your thigh bones, they naturally sit at a slight angle like that. And in general, women's pelvis is a little bit wider, so therefore it's a steeper angle. And this is one of the reasons why women are more prone to falls than men statistically. But the muscles of the hip, not only do they hold pelvis stable, they stop the pelvis rolling in. So when the muscles are not strong enough around the hip and not trained, the thigh bones tend to roll in. You actually see your thigh is kind of pointing slightly across you, and the other thigh is pointing. The thigh should be pointing forwards, not across like this. Again, this is an unstable walking pattern. When the thigh rolls in, it puts a lot of pressure on the knee, and to compensate, the shin bone and the foot tend to roll out, and this flattens the foot. This will cause a bunion over time, because as you're rolling the foot over, it puts pressure on the foot and it deviates the big toe across, and this is why most people have a bunion. It's actually due to an overpronation of the foot, which often comes from a dysfunction higher up around the hip. And this is why we look at the hip and pelvis, and we find if the foot is rolling over when you're walking, often it's higher up and it's the hip and pelvis causing that problem in the first place.